for the last word.
I'll just ask the group here to just stay seated a minute because I'm going to be very short. It's been a wonderful session. The most important thing I want to announce for all of you who are stay-laters, there's a reception on the third floor for all of us that are still awake and interested, and I'm sure we'll get a chance to talk some more. And thank all of you who did participate and added your questions and your comments. Summarizing is insane at this point. I'm going to pick 3 themes, and I'm going to give 3 examples for each. We're going to be spending, the members of the National Cancer Policy Forum will be meeting tomorrow and going through in detail with reports from people that chaired these various sessions to try to pick areas to focus on. So the 3 areas that I heard a lot about, first of all, in science, one theme was systems biology, and the idea that we should explore using systems biology algorithms to decide on what therapies to give patients and how does that get through the FDA, et cetera. But it's ready to be explored. A second theme was the need for N of 1 experiments, and that is an umbrella that includes many things with biomarkers in cases where the disease, a particular cancer, rarely has a mutation. The need to develop trials and collect the data on these trials so that we can settle once and for all, should the drug be subjected to a phase 2 trial in sarcoma, or is it not going to work in sarcoma, even if it worked on that same gene in breast cancer? And the third is how we plan our trials. Do we still need randomized trials? Should we look at trials earlier in cancer and in even pre-cancer? And should the FDA be looking more at the strategy of the trial rather than yes or no on a particular drug? And these are all issues that could be explored. The second area was informatics. The most important point, we need a standardized database in which to place our data. A tremendous need for a registry. Once in one session it was called the National Cancer Data Systems. In another session, it was called a registry. ASCO is developing a registry. We need to share those data. And then the rapid learning system all depend on informatics. And the final area was what I'll call the societal area, which we heard a lot about just now. We need the first talk in the basic science area was balancing discovery science and engineering science and the need for both. And that came up over and over again, the idea that we need collaborations, we need many lenses looking at what we're doing, whether it's in managing survivors or in organizing clinical trials. We need to work together. The second point was sharing data and sharing biobanks and sharing what we've learned with the public education. And the third area was incentivization. We need incentives to collaborate. We need incentives built into our reimbursement systems, incentives for cutting the costs of care. And a number of people presented ideas of how to reduce the costs of care by doing things more intelligently and not doing things that don't work. And then incentives for prevention and incentives for changing behavior and research on how we affect this plague of obesity and poor diet and inactivity, which is going to make smoking the second most important cause of cancer within the decade instead of the major cause of cancer. So those are just some of the themes that I picked up on, and I'm going to thank again everyone and end this, and you're welcome to join us on the third floor for libations.